If you could speak with yourself before you entered medicine, what
Mhm.
would you tell yourself?
Well, from my childhood, I didn't want to do anything else but become a doctor. So I don't know if I can answer that truthfully, but I would not have been happy if I became anything else. My dad, who was an engineer, very good in math, he used to tell me I should become like him, and I told him, no, I'm not going to become like you. I want to become only a doctor. So this is what I always wanted to do. So I have no regret. I would have regretted it if I didn't become one. I feel like this is what I always wanted to do. I'm very happy in spite of my body being tired. I was telling somebody I just am bone tired, but I don't care because I'm doing what I always wanted to do.
And so, for all the pre medical students listening to this, what would you say are the telltale signs that primary care is the right field for you?
If you want to make a difference in somebody else's life, well, if you want to become a cardiologist or a surgeon or an oncologist, I'm not discouraging you. We need cardiologists, oncologists, and all those specialties too, or specialists too. But if you want to make a good difference, if you want to change somebody for good and treat them so that they have a better life, you can treat that person entirely. What I mean by that is you can see that entire person, their whole system, like you study systems in school, right? So the whole system of that particular person is in your hand. You can treat them entirely. You're just not doing the telescopic treatment, right? You're not just treating the murmur, or you're not just treating the abdominal pain. You're treating the entire person. So that is the beauty of internal medicine. I treat patients' depression, anxiety all the time too. So sometimes I feel like I'm a psychiatrist or even a psychologist. I counsel patients. For example, yesterday I saw a brand new patient. She was, going through a difficult divorce. And I actually held her hand and talked to her and tried to console her. Although I'm not a psychologist, I'm not, trained in doing cognitive behavioral therapy of any of those things, but still I could see that by the time I was done with the appointment, she was 50% better. Although she didn't, she disagreed about medications. I prescribed her medications. I'm not sure she's going to take them, but she was 50% better. Why? Because I listened there, talked to her, and I could understand what she was going through. So I just felt like I did some counseling already, and otherwise she wouldn't have taken the step to go see a counselor. So these are things that she can do, and that's where I stand.
And conversely, what are some signs that internal medicine is not right for you?
Yeah, so if you are a person like you don't like sitting and talking to somebody, and there are patients from all walks of life. Some people take more time, some people take only few minutes, but most people want you to spend time with them. Or if you are such a good surgeon, you're very good in doing surgeries, or if you like being a dermatologist, or if you want to just work part-time in that was your future goal, I think you should choose some other specialties. Or if you like x-rays, I used to like x-rays, reading and all those things, but I was not a person who was going to be sitting behind a screen all the time. But we do need radiologists, we do need psychiatrists, we do need um, other specialties like gastroenterology. So I'm not belittling any other specialty. I'm just saying, if that's what you want to do, what follow whatever your heart tells you to do. You
Yeah.
have to be comfortable in what you do. You have to like what you do. If you don't like being an internal medicine doctor, don't become one. Go ahead and become a surgeon, or become a radiation oncologist. Some people like radiation oncology a lot. I probably wouldn't have survived there. So
That's awesome. And last thing, what advice would you give to all the pre med students listening right now?
so the one advice I would give everybody, just an extension of what I just said. You have to be sure in your mind that you want to become a doctor. It's not a bed of roses. It's not going to be like a free ride. There are a lot of obstacles that come up, a lot of difficulties. If you ask me if I ever wanted to go back to mid school and study all that again, I probably wouldn't want to do that, you know? So it's not easy. Although I love being a doctor, the med school training is a little harsh, you know, but that's what prepares you to be a good doctor, because it prepares you to go through any difficulty in life. So you just have to be very sure, know in your heart that this is what you want to become, not what your parents want to become, or not what your friends want to become, or your spouse wants you to become. So that's something that you do for yourself, and have that heart for patients. You know, I always tell people, you know, the best profession in the whole world is this, you know, because you can change people's life. People look up to you, patients look up to you. You can change their lives, you can save lives, you know, like, you know, people always say, oh, why do I need to come for annual physical? I say, I've found so many cancers during my annual physical or their labs. You know, you can prevent so many diseases, save so many lives, you know. But make sure that this is what you want to do always.
Well, Dr. Joel, it has been a pleasure talking with you, and thank you so much for having us. For more information about Dr. Joel, she has a practice called Joel Wellness Clinic in Ypsilanti, Michigan, and you have a great perspective on medicine, and we wish you the best in your practice and career. Thank you.
Thank you, Michael, for having me here. Thank you.